The conventional treatment for mental health is making you worse instead of making you better. It's making you a forever patient. It's making you rely on medications that increase mental illness. It is hindering you from healing. The modern system treats people contrary to our biological needs, contrary to what even causes mental illness. So how do we go about treating it? What works? There is an approach that actually helps heal mental illness so that you're no longer diagnosed with the issue instead of keeping you forever chained to that diagnosis. First, let us look at how the modern system treats mental illness. And we're going to look at a story about Sally. So one day, Sally went to her primary care doctor just for a regular annual visit, and she walked in, she told them that she was there, sat down in the waiting room. 5 minutes later, they called her back. She sat in the private room, and a medical assistant talked to her for a little bit, got her registered, asked her some questions, and the medical assistant asked you the common questions: family history, does she smoke, drink, any changes from her last visit, and she asked the depression screening questions. So Sally admitted to feeling down more than half the days of the week. Then the medical assistant asked further questions about her depression, which led to Sally scoring a higher score in the depression screener. The medical assistant then finished up the questions and the registration and then left the room saying the doctor will be in shortly. A few minutes later, the doctor knocked on the door, walked in, and started chatting with Sally, scrolled on the computer for a minute, looked at Sally and said, "I want to help you not be so sad anymore." And Sally was like, "Oh, well, that'd be great." And the doctor then was like, "Perfect, I'll write you a prescription and you can go pick it up at your pharmacy." And the doctor then finished up her physical assessment and walked out. So Sally went and picked up her prescription. Within 15 minutes, Sally was assessed and given a solution. But if the doctor dug deeper, she would have found the real reason to why Sally answered the way she did on the questionnaire. And the reason we'll discover later. Does that sound right? Does that sound how we should be treating any disease, let alone mental health? Is you go in and 15 minutes after your doctor speaks with you for 3 minutes, you're prescribed an antipsychotic or anti-anxiety or anti-depression type of drug, ones that mess with the chemicals of your brain. You get without any further explanation to why maybe you feel down. Or even if there are reasons that the doctor finds out, do they actually do anything besides prescribe? Besides psychotherapy? No, not conventionally. And that has to change. The modern medical system either prescribes medication, does psychotherapy, or electroconvulsive therapy, or a combination of those three. And that is it. They have a protocol, and if the patient comes in, they fit the patient to the protocol instead of discovering what's actually wrong with the patient. Now, I'm not saying that those treatments are bad in any way. They can be really helpful and good with some patients, but what it causes is this endless cycle of the patient needing medications, the patient needing psychotherapy, electroconvulsive therapy, over and over and over, and they're a patient for the rest of their life for their mental illness. But really, there could be something that's a simple fix, and then they no longer have the mental illness at all. So why are we continuing in a cycle that doesn't do anything? Various things can affect the brain's health. This means that there may be an underlying problem that is elsewhere in the body, elsewhere in the environment, that's causing the brain to not work properly, to not feel proper, and it's going to continue that until something else in the body or environment is fixed. And that is how we get to actually treating mental illness, is treating the root cause of why you have the mental illness. Now, there's many different causes to mental illness, and we have to start there. We have to start what are all the causes? And there might be more to be discovered, but there's spiritual causes. Do you feel like you have a sense of purpose? Do you feel like you have this guilt upon you? You don't have hope. There's environmental causes. Mold can cause you to have suicidal thoughts. Just mold alone. Crazy. Allergies, workplace conditions, home life, social network, stress. In the body, any hormonal imbalances, any gut imbalances, chronic inflammation, insulin resistance, so many things within the body. If they are stressed out, the brain's also going to be stressed out. Your diet can cause mental illness. If you're eating a ton of ultra-processed foods, if you're eating a low-fat diet, the brain is made of a lot of fat and it needs fat. If you're just eating nutrient-depleted food, there's lifestyle factors. If you're living a very sedentary life, if you work night shift, if you have poor sleep hygiene, many, many more causes to mental illness. And if we listen to a patient who has mental illness and actually ask them, what are they eating? What are they doing in their day-to-day? What do they like to do for fun? What's happening in their family? What's happening in their friend groups? Has there been any floods in their house? What state are they living in? What are they dealing on a day-to-day basis at work? If we ask deeper questions, we could probably unveil some things that need to be fixed in order to get the brain back to normal. What type of practitioners do it right? Any kind of holistic practitioner, and you got to be careful to make sure that you're staying away from pagan practices, because those are also a promise with no backbone, or they're anti-Christian. Holistic practitioners focus on you as a whole being. They look at your body, your lifestyle, your diet, your whole health, your health history, your family's history. They look at your social life, everything. And they take that all into consideration when they're treating your health, when they're figuring out what's wrong with you. And they integrate a thorough assessment. They do therapies, they do lifestyle modifications, they do mental exercises, spiritual exploration, and they continually monitor you and continually check in to see what's working, what's not working. This type of treatment breaks the cycle of the continuous medication and psychotherapy that the conventional system conforms to. A doctor did a thorough data research study, and she came to this conclusion. Depression arises from the complex interplay among biological, psychological, social, environmental, and spiritual factors. In contrast to framing depression solely as a brain disease, which places responsibility for change primarily at the individual level, the holistic approach expands intervention possibilities and encourages comprehensive solutions. Viewing depression through this integrative lens allows for the identification of diverse pathways that actively foster flourishing, resilience, and overall well-being. This is evidence-based. It's actually insane that we aren't treating mental illness by looking at the whole person. It is just crazy to me. Looking a little bit more at the traditional Chinese medicine route, they also focus on the whole body, but they have a focus that an ill person is an out of balance person, and their whole thing is restoring the person to balance. And once the person is restored to balance, their body does the healing, which is pretty true. Our bodies have healing mechanisms in us, but if those are compromised, we're not going to be able to heal. But if we fix the body to where it's able to heal itself, then it will, which is so cool. So that's the focus of traditional Chinese medicine. It tends to sound woo-woo because they use terms from thousands of years ago when they didn't have the scientific terms for it, and now we do. And each thing from TCM aligns with actual science. And so it does sound woo-woo at times. I'm sure there are a little bit of woo-woo-ness in parts of TCM, potentially. I don't know, but a lot of their terms translate into the scientifically known biochemistry and pathophysiology of our bodies that we know today. So as it relates to mental health, TCM fixes the root cause, which then the brain heals from whatever was off in the body or environment. So back to Sally. She, this time, actually went to a holistic health practitioner, and she walked in the office, checked in with registration, and then sat down in the waiting room. 5 minutes later, she was called back, sat in a private room. The doctor comes in, sits down next to Sally, and asks how Sally's doing. They have a conversation. This lasts 30 minutes. The holistic doctor also discovered that Sally admitted to feeling down most days out of the week. The doctor asked, well, what's going on in Sally's life? What's happening? What's been changing? And Sally opens up that she's been really stressed out at work. Doctor asked what's specifically stressing her out, kind of got to the bottom of that, and the doctor continued to ask diet and lifestyle questions, and the stress at work that Sally was having was causing her to consume a lot of sugar for multiple times throughout the day, and she was doing that for a few months. The doctor then helped find where Sally could change her habits around when she has a stress trigger. Instead of eating a sweet, to do some mental health practices, some breathing exercises, hydration, going for a walk, different suggestions, and they got to something that Sally believed that she could do, believed that it's something that would work for her. Sally committed to trying something else out. A month later, she gets a phone call from her doctor, and the doctor was just checking in with her, and Sally said, I have been doing amazing. Every time I feel stressed out, I just go for a walk and I breathe, and I feel so much better. And actually, I have recognized that the thing that's stressing me out at work, I just had to change a couple things to help me not be overwhelmed by it, and it's still happening, but I know how to not let it beat me. And Sally became a stronger, better person through this experience instead of being enslaved to medications and psychotherapy. The doctor was so pleased to hear Sally's story and encouraged her, and Sally was able to stick with that for the rest of her life. Had Sally just stuck with the medication, she would have been on them her whole life. And she would have been in the same stress cycle, and she would have ended up gaining more and more weight from constant sugar intake, and then would have had even worse mental health because not having a fit body also increases mental illness. Just by simply digging a little bit deeper, Sally was taken care of. You also deserve to be listened to. Your story deserves to be listened to. So please find a holistic practitioner that will listen to you, because your story matters. I did want to point out that history did not always have mental health treatment, right? In fact, they had it kind of severely worse at points. They would drill holes in the skull, they would do lobotomies, they would do bloodletting, They would do shock therapy. They would purposely induce seizures. They would do intense spinning, like literally spinning somebody around and around. Didn't work. Imagine that. They would poison people. It is crazy. They just focused on like, the problem is in here and we need to get it out. And they were so blinded by it. The problem's here. The problem's just in the mind, that they only treated with that in mind. And so that is exactly what the medical system's doing today, conventionally. And thankfully not to that severe of a degree, but still focusing on the wrong thing. As a whole, the modern system is a band-aid solution at best. They numb you, they delay episodes from happening. However, you're gonna forever be a patient if you go the conventional route. The antipsychotic medications don't heal you. They just mess with the chemistry of your brain so that you feel a little different. But you're never gonna feel 100% yourself that way. I am not saying to go off any medications. Anything to do with medications, talk to your doctor about. Anything to do with medications. And your anything with your health, talk to your doctor. But I urge you to find a holistic doctor, because the modern system is lying to you. Root cause healing is what works to heal anything in the body, including the brain and the mental health. I am personally a holistic health coach, so I work with people one-on-one to help them go from feeling overwhelmed and out of balance to feeling happy, healthy, confident, balanced people. And if you want to work with me, you can click the link down in this description of this video. I would love to work with you. What is your experience with mental health treatment? I would love to hear your story. Please leave a comment down below and like and subscribe. Thank you so much for watching. Bye-bye.